Immunodeficiencies are like cracks in the immune system's armor, and the pattern of infections gives away exactly where the defect is. Whether it's recurrent bacterial, fungal, or viral infections, these disorders show up frequently on step 1. Grouping them into B cell, T cell, and combined makes everything easier to remember. Let's break it down. Starting with B cell immunodeficiencies. First is X-linked A gamma globulinemia, also called Bruton's A gamma globulinemia. It is caused by a defect in the BTK gene, which blocks B cell maturation. These patients, typically boys, have recurrent bacterial and enteroviral infections starting after 6 months when maternal IgG wears off. Labs show absent B cells and very low immunoglobulin levels. Next is the most common primary immunodeficiency, selective IgA deficiency. These patients may be asymptomatic, but some have mucosal infections, allergies, or autoimmune diseases. A high-yield USMLE clue? They get anaphylaxis with blood transfusions due to anti-IgA antibodies. Fine. Then there is common variable immunodeficiency, CVID. Unlike Bruton's, this one affects both sexes and presents later in adolescence or adulthood. Patients have low immunoglobulin levels, recurrent sinopulmonary infections, and increased risk of autoimmune disease and lymphoma. Now let's talk T cell disorders. The big one is Dye-George syndrome caused by 22q11 deletion. It leads to defective development of 3rd and 4th pharyngeal pouches, resulting in thymic hypoplasia, hypocalcemia, and congenital heart defects. These patients have low T cells and are prone to viral and fungal infections. Next, interleukin 12 receptor deficiency leads to impaired T helper 1 response, resulting in decreased interferon gamma. These patients suffer from disseminated mycobacteria and fungal infections, especially after BCG vaccination. Hyper IgE syndrome, also called Job syndrome, results from a STAT3 mutation. You will see elevated IgE, recurrent skin abscess, coarse facial features, retained primary teeth, and eczema. The mnemonic is FATED, F-A-T-E-D. Face, abscess, teeth, eosinophilia, and dermatitis. You can remember like that. Chronic mucocutaneous candidiasis is another T cell dysfunction. These patients have persistent candida infections of the skin and mucous membranes and often have normal CBC and immunoglobulin levels, making it a diagnosis of exclusion. Now for combined immunodeficiencies. First, severe combined immunodeficiency is a medical emergency. It can result from adenosine deaminase deficiency or defective interleukin 2 or gamma chain or other mutations. Babies present with failure to thrive, chronic diarrhea, and severe infections. The classic finding is a bubble baby with no thymic shadow, low T and B cells, and absent T cell receptor excision circles. TREX. The next is ataxia telangiectasia, which is caused by ATM gene mutation leading to DNA repair defects. Patients develop progressive cerebellar ataxia, telangiectasias, and increased AFP. They are also prone to infections due to low IgA. Wiskott-Aldrich syndrome is X-linked and presents with a triad eczema, recurrent infections, and thrombocytopenia. These kids have small platelets and often develop autoimmune disease or lymphoma. Remember the mnemonic water. Wiskott-Aldrich, thrombocytopenia, eczema, recurrent infections. The next is hyper IgM syndrome. This is due to defective CD40 ligand on helper T cells, so B cells cannot undergo class switching. So the result? High IgM, but low IgG, IgA, and IgE, and these patients suffer from recurrent infections, especially with opportunistic organisms. Chediak-Higashi syndrome involves a lysosomal trafficking regulator gene defect leading to giant granules neutrophils and impaired phagocytosis. Key features include albinism, recurrent infections, neuropathy, and pancytopenia. Finally, leukocyte adhesion deficiency is caused by defective integrins. Neutrophils cannot migrate to site of infection, so you get delayed separation of the umbilical cord, absence of pus, and persistent leukocytosis. A quick recap. Let's run it back. B cell for Bruton's IgA deficiency, CVID. T cell, remember diGeorge, interleukin 12 receptor deficiency, Job syndrome, and mucocutaneous candidiasis. And combined, remember SCID, attacks at telangiectasia, Wiskott-Aldrich, and hyper IgM. Phagocytic or adhesion defects, remember Chediak-Higashi and LAD. Each one has a unique fingerprint. Memorize a classic clues like retained teeth, telangiectasias, or lack of pus, and the question practically answers itself. You have just mastered one of the hardest chapters. Keep pushing forward. We are almost at the finish line. You have got this. Thank you. See you next episode. And this is Dr. Ram here from MedMadness.